Good afternoon to each and everyone. Thank you so much for joining me today. I am back again with another Cura Talks, and this time, as I told you, I've taken up a poll of what to cover. So I'm breaking off my league of pregnancy and giving a short break and discussing कुछ बहुत ही महत्वपूर्ण, बहुत important, जो बहुत commonly आजकल हम women में देख रहे हैं. That is adenomyosis and endometriosis. So, what is this adenomyosis and endometriosis? Before we start, I want to let you know कि आप free हैं to ask me any questions. I'm going to take up all your questions in today's session, and I'll be happy to answer whatever queries you have in regards to adenomyosis and endometriosis. Those of my viewers who are wondering that where did the other talk go? Well, since it was a tie between adenomyosis and endometriosis, so next month we're going to cover the mental health impact after COVID-19 pandemic. So, without wasting any time, let me start by talking about adenomyosis and endometriosis. तो ये सबसे पहला क्वेश्चन जो मुझे सबसे ज़्यादा इनकाउंटर होता है ना डे टू डे प्रैक्टिस, ये adenomyosis और endometriosis सेम चीज़ है कि आर दे डिफरेंट? So adenomyosis and endometriosis, well, they are different, but it won't be wrong to say that they are kind of a same spectrum, because जो दोनों diseases हैं ये एक टॉपिक इम्प्लांटेशन, दैट मीन्स जहाँ इम्प्लांट होना नहीं चाहिए एंडोमेट्रियल टिश्यू को, वहाँ पे होने से ये दोनों डिजीजेस होते हैं. बट दोनों ही डिजीजेस की एडिनोमाइसिस की साइट अलग होती है इम्प्लांटेशन की, और एंडोमेट्रियोसिस की साइट अलग होती है. नाउ आई नो दैट वी आर नॉट डॉक्टर्स सिटिंग ओवर हियर, राइट? बट एज अ डॉक्टर, एज अ वुमेन इमेजिंग स्पेशलिस्ट, इट्स माई ड्यूटी टू टेल यू दैट व्हाट इज व्हाट. So, I'm Dr. Soumya Devedi. I'm the Director and Chief Radiologist of Cura Diagnostics Bhopal, and we conduct Cura Talks every month, and we try to educate as many women as possible for a strong women empowerment. And I have done my super specialization in women imaging, and that's why I have keen interest in teaching and educating everyone about that, because I genuinely believe that अगर एक औरत educated है, aware है अपनी body के बारे में, तो वो पूरी family को educate कर सकती है और उनका perception to bring up their entire family change कर सकती है. So yes, we are here, and फर्स्ट एंड फॉरमोस्ट, क्योंकि हम adenomyosis और endometriosis की बात करें, we need to have knowledge of our female reproductive system. So what I've done is I've drawn a short diagram for you so that we can understand better what we're dealing with today. So this is a small diagram. I hope you can all see, right? So this is the uterus, okay? That is the female reproductive organ. So what happens is that this is the uterine cavity, this is the endometrium, इधर आती है सर्विक्स और उसके नीचे आती है वेजाइना. वेजाइना इज द पार्ट विच इज ओपन एंड इज कवर्ड बाय हाइमन समटाइम्स. सर्विक्स इज क्वाइट इनसाइड, एंड देन कम्स द यूट्रस, एंड इनसाइड इन बिटवीन दिस ट्रायंगुलर कैविटी यू कैन सी इज द एंडोमेट्रियम. सो जब फीमेल रिप्रोडक्टिव ऑर्गन नॉर्मली काम करता है तो एवरी मंथ ये एंडोमेट्रियल लाइनिंग कॉन्ट्रैक्ट होती है, एंड वी हैव मेंस्ट्रुएशन और वी हैव पीरियड्स. ओके, दिस कैविटी यूट्रस इज connected by two tubes on the right and the left side, and these are the fallopian tubes, this one and this one. And then it has got many parts like the isthmus, ampullary tubular portion, and the fimbriae, which looks like the fingers, which are in turn connected with an ovary, both on the right and left side. The ovaries have follicles, which in turn बनते हैं डोमिनेंट फॉलिकल, एग रिलीज करते हैं, एंड हमें कंसीव करने में हेल्प करते हैं, एक बेबी फॉर्म करने में हेल्प करते हैं. So when this egg releases every time and it does not get sperm over here, it does not get implanted, we have periods. So that's how the female reproductive system works. So it should work like this every month, okay? And when this doesn't work, then it causes all the period problems which we have. And believe me, सबसे common आजकल जो period problem as a radiologist, as a women imaging specialist में देख रही हूँ, वो है adenomyosis की. Yes, it's very surprising because I'm sure 25 years back this term was not used this commonly, but now every third patient which we see in day-to-day practice is having spotting or is having irregular periods, and is having a lot of crampiness during her periods or clotting during her periods, and they all in turn have adenomyosis when we do a sonography. So yes, adenomyosis can be easily diagnosed on sonography easily, and there is no other test like hormones or anything which can rule out that whether this patient is suffering from adenomyosis. But a good transvaginal scan can definitely rule out whether which grade of adenomyosis also you are suffering. And yes, adenomyosis is treatable to some extent, but not when you are severely affected by adenomyosis. You have the only option left as hysterectomy. So instead of commenting on treatment, let's start by talking about what is this adenomyosis first. So I have one of my juniors attending. So hi, how are you? Thank you for joining us. So yes, so what is adenomyosis? Like I told you, जो ये endometrial lining है, अगर during menstruation या during any time of your periods, what happens when the cells of this endometrium go and implant in the uterus and it causes a lot of swelling or bulkiness, that is adenomyosis. So implantation of the endometrial lining in the uterus in the uterine muscle is adenomyosis. So it can show in many variable forms. It's not necessary कि हर women will suffer same type of symptoms. So it has a very variable list of symptoms which present to a female. But a very classical history which we encounter in a day-to-day life, very classical history when the patient comes to us. तो अगर for example a female of 32 years old presents to us with common history of spotting, that means कि उसकी एक normal cycle 4 to 5 days की आ रही है, but she is continuously spotting very little every day. She does not require usage of pads, but she does spot. And she's got a lot of lower pelvic pain, नीचे lower abdominal pain which radiates through the back, and during her period she has a lot of clotting. So this is a very classical history of adenomyosis. And when you do the transvaginal scan, you might get all of these findings. That is, you will get linear bars and hyperechoic islands and adenomyomas. Yes, many a times this condition is having a very close differential, closely misdiagnosed with fibroids, and is treated as a fibroid should. That means कि fibroid को निकाल देते हैं laparoscopically, but in turn the patient has adenomyosis, उसकी पूरी muscle affected है, and the final result is the patient is not treated or relieved of symptoms. So it's very important as a doctor to diagnose whether this is actually adenomyosis or you're just dealing with leiomyomas or fibroids. Okay, fibroids अपने आप में एक बहुत common disease है जो it's said that around 60% of females do suffer from fibroids in once in a lifetime, and even adenomyosis now, the number of adenomyosis incidence is gone up to 70 to 75%, which is a very high number. तो ये किसको हो सकता है? So किसको हो सकता है is approximate age group of they said that around 25 years से 60 years के बीच में किसी को भी हो सकता है. इसका peak incidence 30 to 40 years के बीच में आता है. So adenomyosis कैसे पता चलेगा अगर आपको adenomyosis हो रहा है तो? First of all, you will have a lot of clotty bleeding and your cycle will start coming early. So a normal period cycle, किसी को अगर पता हो तो a normal menstrual cycle, a normal period cycle can range from 28 days to 34 days. Anything before or after that is delayed or early is wrong. Alright, and if it's abnormal then you need evaluation. तो अगर आपके periods for example every 28 to 29 days आते हैं, every 30 days आते हैं, और अगर आपकी पीरियड सडनली ऐसा पैटर्न बन गया है कि आपकी पीरियड्स 5 days बिफोर आने लग गए, 25 days में आने लगे, 20 days में आने लगे, that means that should alarm you, that should raise your red flag high, and you must get a transvaginal ultrasound, transvaginal sonography. If you're unmarried and if you want to get yourself scanned, then pelvic ultrasound with full bladder is recommended. इसमें हम adenomyosis के features को easily rule out करते हैं. So you will say जब ये disease adenomyosis अपने muscle में affect कर रहा है तो ये अंदर की lining पे क्यों प्रॉब्लम दे रहा है, ये हमें पीरियड्स कैसे डिस्टर्ब कर रहा है. वेल, जब ये लाइनिंग आपकी सूज जाती है, दिस लाइनिंग गेट्स इन्फ्लेम्ड, द मसल गेट्स इन्फ्लेम्ड, इट इन टर्न puts pressure on the endometrial lining, which makes it irregular, and hence you get a lot of spotting. Instead of a normal trilaminar layer of endometrium, you have a very hazy, irregular, indistinct endometrium, which in turn causes period problems. Also, when all of this process is happening and the uterus is so large in size, so bulky, it's definite that the peripheral nerve innervation definitely gets impaired, and you will have lower back pain, which can radiate even to your legs, even cause a lot of crampiness in your uterus. Imagine that you have a uterus of 4 months pregnancy. The uterus can get enlarged up to around 8 to 9 centimeters also many a times in adenomyosis. So yes, it's a very painful condition, and this is a very big myth. Whenever people who are millennials, they'll understand this, that girls who've been brought up in that era have been told that, all right, normal period cramps are normal and you should not bother about it. No, not anymore, because we have better clinical diagnosis now. We can understand that having such painful period cramps is not at all normal. And जैसे कि मैंने आपको बताया, अगर आपका period cycle early होने लग गया है, you have around 20-22 days cycle, you have clotting, and you have a lot of crampiness during your periods, or generally cyclical crampiness and spotting throughout your month, then you should get a transvaginal ultrasound and rule out whether you're suffering from adenomyosis. Now, since the cells of the endometrium are going and implanting in the muscle, then sometimes these cells can also get implanted in the ovary, or in the tube, or in the surrounding peritoneum, okay, or in the bowel, आपके intestine की walls पे भी. When all of this happens, then we suffer from endometriosis. And yes, endometriosis is a difficult condition to treat. It's not easy to treat. And now we have super specialized people who treat endometriosis. Sometimes people who have had previous surgeries like cesarean sections for their deliveries can also develop scar endometriosis, which can be painful. Your periods can be absolutely fine because your ovaries are not involved, but at the scar tissue, this endometrium goes and gets implanted on the scar area and causes you needle-like piercing pain. So endometriosis is very classical in a way that the pain will be very cyclical. मतलब जब आपकी cycle का time होएगा, तब आपको prickiness, वो pain feel होने लगेगा. And also obviously on ultrasound you will definitely diagnose whether you have an endometrioma or not. So for a layman, आप लोग ने बहुत बार सुना होगा कि इसको chocolate cyst हो गया है. तो chocolate cyst क्या होता है is basically clinically when we say that it's an endometrioma. Why? Because an endometrioma का अंदर का जो fluid collection होता है वो chocolatey color का होता है. It's a chocolate color, and that's why when you drain it laparoscopically or when you remove it, you see that chocolate oozing out of that cyst, and that's why for a layman it's said that it's a chocolate cyst. So endometriosis is also a very painful condition. That's why I said जब adenomyosis और endometriosis को हमें हमेशा साथ में एक पिक्चर लेके चलना चाहिए, because finally eventually what's happening is that the endometrial cells are getting implanted either in the muscle or anywhere outside the uterus, like the tubes or the ovaries or the peritoneum or the bowel or in the scar or even any other abdominal organ also. There is a very detailed lecture with a specialized faculty which I conducted last year, Dr. Abhishek Mangeshkar, and he has commented and given us all details about endometriosis, which I think people who are suffering from endometriosis can go back to my page and look for that IGTV. And it'll be very very useful for you. So endometriosis अपने आप में एक बहुत बड़ा टॉपिक होता है. इसका सिम्टम कैसे होता है, जैसे कि उन्होंने तो बताया कि आपको पेन होगा every month with clotting again. So both have very close symptoms, but both appearances are totally different. And it's very very crucial that in the era we live, first and foremost हम ये break करें myth कि having painful periods is okay or is normal. No, it's not. And that's why अगर आपको ये pattern change दिखे अपनी cycle में as a woman, you must be vigilant and go ahead and get this 5 minutes of ultrasound, from a specialized person, and that will really help you to rule out, adenomyosis or endometriosis. So this is the next question which I was asked in my poll. How does these conditions affect pregnancy? Since adenomyosis or endometriosis around 25 years से onwards कभी भी हो जाता है, so how does it affect pregnancy? Well, if you have set in this disease that early in your life as a female, so like I told you, since it's involved all your muscle, it's disturbed all your lining. This is where the baby actually comes and gets implanted. Okay. So when this is, irregular, indistinct, how will an implantation happen? Is that logical? Okay. So the uterus has to be okay. The ovaries have to be okay. So अगर आपको endometriosis है तो आपकी ये ओवरी काम नहीं कर रही, फॉर एग्जाम्पल. अगर आपको adenomyosis है तो आपकी लाइनिंग ओके नहीं है, तो इम्प्लांट होने के लिए बेबी प्रॉब्लम होगा. मतलब इम्प्लांटेशन ही नहीं होगा, बेबी बन रहा है बट इम्प्लांट नहीं होगा तो आपको मिसकैरेजेस होते जाएंगे. So it's very, very important that a human reproductive system works well, not only for the females but also for the male. But that's how it affects the pregnancy, because for example, if you have a large adenomyoma, which is, suppressing or compressing the lining of the cavity, then again it will put pressure on the lining and no implantation will happen. The baby will not get attached. Okay, so this lining has to be trilaminar and thick and nice with a good blood flow, and good blood flow can only be there when the uterine muscle is okay. So yes, many a times ये notion भी रहता है कि आपको suggest कर देता है आपको डॉक्टर, alright, you have adenomyosis, it's grade 1. There are, for your information, there are 3 grades, mild, moderate and severe. So अगर आपको grade 1 adenomyosis है, आपको suggest किया जाता है if you're married, you should conceive early, because grade 1 adenomyosis many a times does not disturb the lining. It is when you have moderate amount of adenomyosis, it does disturb the lining of the uterus. So if you do conceive, it stops the process of making adenomyosis more severe. So it's very, very important कि अगर आप diagnose हो चुके हैं adenomyosis से and you still don't have babies and you plan to have, then you should go ahead and try to conceive earlier, so that at least it will delay the process of making the adenomyosis severe. So yes, that's how it impairs the process of pregnancy if you are suffering from adenomyosis and endometriosis. Good part about endometriosis is, if only your ovary is involved and you have a very concised appearance कि आपके endometriosis जो है आपकी सिर्फ ovary में है and you have just one simple cyst, then your cyst can be removed. Or if you are suffering from adenomyosis and you just have localized or focal adenomyoma, like we say, and you don't have any other findings, your lining is okay, then also laparoscopically this thing can be removed and your uterus can be as normal as possible, and then you can try for pregnancies. So that really depends कि आप कौन से stage of this disease में है, so that your treatment can vary accordingly. It's not necessary that every time you do need a surgery, but yes, I would say that there is a misnomer in the society that hormonal supplementation can deplete or can reverse the process of adenomyosis or endometriosis. Well, no, not anymore. It's a very old theory. So if you have a lesion of endometriosis, you do need removal of that lesion if you don't want the disease to extend further, and removal also in a way कि आपका वो disease spread नहीं हो, because once you pop the endometrium or the chocolate cyst, it can spread everywhere in your adnexa and hence cause all the adhesions. What are these adhesions? So जैसे कि मैंने आपको बताया, ये uterus है, ये tubes है, ये ovaries है, इसके आसपास का area is free floating and just attached by ligaments. Okay, and instead of ligaments, जब ये स्प्रेड हो जाता है, ये रप्चर हो जाता है सिस्ट अंदर, तो ये सब चिपक जाता है. It sticks like with spider webs. So spider webs जैसा ही कुछ adhesions जैसे बन जाते हैं जो आपकी ओवरी को चिपका देते हैं, आपकी ट्यूब्स को चिपका देते हैं, आपकी यूट्रस को चिपका देते हैं. So it causes you a lot of pain, and it also hampers the function of the ovary, which is going to finally stimulate an egg to make a baby. So this is all a spectrum of one disease, that is ectopic implantation of the inside lining of the uterus, that is called the endometrium. So ectopic implantation of the endometrium on the uterus or any other organ of the body like ovaries, tubes, bowel, peritoneum, scar area or other abdominal organs also. Sometimes endometriosis is very rare, but it's also found in the lungs, and that's something to think about, that how these ectopic cells do transfer. There is one theory which suggests that जब आप रेगुलरली अपना मेंस्ट्रुअल साइकिल होती है उसी दौरान आपकी एंडोमेट्रियल शेड्स कभी कभार ट्रांसफर हो जाते हैं बाहर, and that's how this disease spreads. Or if you are undergoing a surgery and during the surgery जब आपका proper closure नहीं होता है यूट्रस का and the endometrium is touched, then these cells do get transferred from there also to your scar site or other areas outside. So ये एक predisposing factor भी होता है कि if you have delivered one baby, after that many ladies suffer from adenomyosis. So one predisposing factor is that. Second predisposing factor is if you have undergone any other surgeries, not just pregnancy, any other surgeries, and the endometrium has been touched at that time, that can also cause adenomyosis and endometriosis. So also one question was asked to me that the CA125 levels एक blood test होता है जिसमें हम carcinogens को देखते हैं कि a female is having any malignant or cancer cells in her body. तो ये CA125 endometriosis में भी high होता है. Like I told you, कोई भी कैंसर में अगर abnormal cell deposit होता है तो कैंसर बोलते हैं उसको. That's how the mechanism is of having malignancy. Likewise, जब एंडोमेट्रियम अपनी नॉर्मल साइड से हट के कहीं और इम्प्लांट हो गया तो इट इज वर्किंग जस्ट लाइक अ कैंसर, बट इट इज नॉट कैंसर, इट इज बिनाइन. इट विल नॉट बी फेटल, बट इट विल बी वेरी वेरी पेनफुल. There is a survey which was done a year back, and in that diseases were rated for painful threshold, and in that endometriosis topped the list of pain all over the world in all the diseases, men or women, and it is that painful. It's not you can't compare that disease कि आपको endometriosis है और आपने डिलीवरी की है उसका पेन. No, the pain is much much higher. If you even deliver normal baby, उससे पेन बहुत हाई रहता है. So yes, it is very painful disease, and Indian women को अगर मैं address करूँ, they have this speciality, I would say, that they have this willpower to tolerate pain, and they've been taught and brought up in this manner that they don't easily go to the doctor and share their symptoms. So that should not be the case. And जितना आप डिले करेंगे, अपने सिम्टम्स को बढ़ने देंगे, इस पेन को टॉलरेट करेंगे, आपका डिजीज उतना ही बढ़ता जाएगा. एंड इफ यू आर अ यंग गर्ल इन योर 20s or 30s and still not started your family way, then it is very very crucial for you to be vigilant on this point, because I feel जो trend मैं अभी देख रही हूँ in our day to day practice, by in next 20 years this shift of disease will be there in early 20s as well. And it's very very it's far importance कि आपको ये concept समझ आए that what is your normal menstrual cycle, and if there is any disturbance in it, only you can be vigilant about it, not your mother, not your friend, not your sister. You have to be vigilant, and once you are aware, then only you can take action and go to a doctor and get yourself treated earlier. And at least if not get completely treated, at least stop the cycle of this disease and not spread it further. Because why is it so that we are seeking such a peak in infertility these days? It's also because of the lifestyle, I would agree, but it is also because of all these things that we've been ignoring throughout our life. So yes, you must not ignore your body as a woman, and it's very very important. अगर आपको अपना ही pattern नहीं पता हो, what is a normal menstrual cycle, what is a normal reproductive system, then you can't blame anyone in your family for it. So I'm not here to lecture, but I really feel that it starts there and then. A woman in a 20 needs to be as aware and as vigilant about her body, her periods, her cycles, her symptoms, so that you can approach a doctor in a better manner, you can explain in a better manner, get diagnosed earlier, and get rid of all these symptoms, and decrease the rate of infertility which is surrounded by us these days. So I think I'm going to wind up on that note, and thank you so much everyone for joining me, and thank you so much again for that lovely poll I received yesterday. It was such a great participation. I'm so enthusiastic that you want to hear so many good things, especially the mental health impact. I'm touched by it because I really feel that there's a research which I did a few months back on how the mental health impact on COVID-19 happened, and believe me, it's a very interesting topic to share, and we're going to talk about it in the coming month. Today we have talked about adenomyosis and endometriosis, and I'm sure आपको कोई भी और queries हो तो आप मुझे DM कर सकते हैं. I'll be happy to answer them. I'm also available at Cura Diagnostics and Research Center, which is located at Chuna Bhatti, Bhopal, and I have specialized in women and pregnancy imaging, and that is my forte. That's why I want to educate as many women and girls possible, so that we have a better future, a healthier future, and a much aware woman league, right? So I hope you stay healthy, and I look forward to see you again next month. Thank you so much. Adios.